Hey, Dean.
Hi. Yes, doctor. I've developed lymphedema in my lower legs, and I believe it was caused by a very bad sunburn that I had about 25 years ago.
All right.
And it's mainly in my lower right leg and ankle, and it tends to swell throughout the day, steadily gets worse, and I do have polycystic kidney disease, too, with about a 38% function.
All right.
And according to my doctors, they say there's not that much I can do. They tried diuretics, and I do use compression socks occasionally, too, but I'm pretty sensitive with it, and it's tough to be active in Florida with this condition. So I was wondering what input you could give.
All right, Dean. Question. Okay. With this, you were out in the sun. Did you burn both legs or just one?
Believe it or not, it's just how the sun angle was.
No kidding.
Mainly the tops of my ankles, and it was mainly my right ankle, and ever since then my problem developed over the last 20 or 25 years.
Okay. Does it hurt you when you get in a tub of hot water?
I don't use tubs. I shower.
Okay. Yeah, 'cause oddly enough, okay, you can burn the extremities like this. Okay, in other words, sometimes you can see this from immersion, either hot or cold, and you'll end up with small vessel damage, and you'll end up with small nerve fiber damage. It's kind of a neat problem. And so there's some tricks that you can do to settle it down. The lymphedema is one thing. Those are the nervi vasorum. Those are the nerves that innervate the blood vessels themselves. Very, very small, they're unmyelinated fibers. They can be damaged from diabetes. They can be damaged from B12 deficiency, a bunch of things. But thermal burn is not uncommon. And you'll see this with trench foot. You'll see this with immersion foot. You'll see this with burns of this nature. But most typically, the place that I see this occurs in folks that step into a hot tub that's too hot. Okay, they get parboiled essentially. And then for years and years and years, you can have pain, dysesthesia, swelling that'll go up to a level. Well, with a burn of this nature, it's a little bit less likely, but there are some tricks that you can do. Now, the question I'm going to have is right foot, right leg. How much area are we looking at? What's the surface area if you had to guess?
The top of my foot, primarily the ankle, where you can't even see the ankle bone later in the day, and up to my calf. And also, I do develop restless legs at night, and I think that'll
contribute to it. Yeah,
the lymph system starting to work a little bit.
It could be, but also you'll see this for magnesium deficiency. That's much more common. All right, so far as the RLS is concerned, that's an easy one. You just simply take a chelated magnesium, 150 to 300 milligrams at bedtime. Do anything but magnesium citrate. You do that, you'll be pooping all over the place. You will not absorb the magnesium. It's nonsense. But what you can do, which is actually kind of cool, is to get a transdermal progesterone. And what you're looking for is 20 milligrams per ml. These are available over the counter, believe it or not. They probably shouldn't be, but you can find them. And you go topically with progesterone. In that dosage, it will assist in remyelination of these fibers. The process takes, maybe 6-8 months. May not take that long. The second thing you have to do for a more immediate effect is an essential fatty acid, an omega-3 called alpha-lipoic. Now, you don't need to get the expensive alpha-lipoic. You can get the racemic, the cheaper stuff. And what you do is you take somewhere between 1,000 and 2,000 milligrams daily, and that should make it start feeling better a whole lot quicker. So alpha-lipoic with topical progesterone should square this puppy away. And then for the restless leg, magnesium. And what you're looking for is magnesium malate, magnesium taurate, or magnesium glycinate. I don't really care which one of the bunch you get. It doesn't make any difference, but they need to be absorbed. So, Dean, my friend, give that a whack and see what's going on. We'll get your leg feeling better.